Cancer patients may be dying too early due to preventable blood clots, MPs have said. There were 4,224 cancer deaths in England and Wales last year that may have been caused by preventable blood clots. A report from the All-Party Parliamentary Thrombosis Group, APPTG, said. It found that the number of patients who died of cancer who also had venous thromboembolism, VTE, listed as a cause of death rose by an average of 3.2% each year between 2012 and 2015. This rate is more than 4 times higher than the average annual increase in overall cancer deaths for the same period. VT is the collective name for deep vein thrombosis, DVT, which is a blood clot in one of the deep veins in the body, and pulmonary embolism, which is a blood clot in the blood vessel that carries blood from the heart to the lungs. Cancer increases the chance of blood clots, and chemotherapy can add to this effect. Symptoms of a clot include pain, redness and swelling in a leg, breathlessness and chest pain. Labour MP Andrew Gwynn, outgoing chairman of the APPTG, said, "It is especially tragic for those patients who are beating their cancer to subsequently die of a clot that could have been prevented. This is clearly a rising problem, which is why it is imperative that cancer patients understand their risk and that cancer treatment centers have dedicated policies in place for managing their patients' risk." Professor Beverly Hunt, Medical Director of Thrombosis UK, said, "These facts and figures about cancer-associated thrombosis, CAT, highlight the concerns held by thrombosis experts that there is not enough attention paid to this serious complication of cancer and cancer treatment. Some 10% of all cancer patients will have CAT at some stage of their illness, and it remains the major cause of death after cancer itself." Despite all this knowledge, most cancer patients don't know about their risks or what signs and symptoms to look out for. Data collected by the APPTG found that only a third of NHS hospital trusts have a dedicated policy or pathway for the risk assessment and management of suspected blood clots in patients receiving chemotherapy. Less than half gave patients both written and verbal information on the risk of developing a blood clot during cancer treatment, and symptoms to look out for. Watch more videos at video.5la.net.